In this video, I'll be focusing on two things. It's on chronic heart failure. Number one, the clinical features of heart failure. Number two, the management of heart failure. It's quite difficult to diagnose heart failure because the signs and symptoms are quite non-specific. So in here, I'll be going over the signs and symptoms of chronic heart failure and giving you some hints how to diagnose that in the actual exam, and then going into management. So breathlessness. Now that could be on exertion, the feeling breathlessness, could be at rest, or we could be having orthopnea, they're lying flat and they're having breathlessness. Fluid retention, so they can be having ankle swelling, they can be feeling bloated, they could be having abdominal swelling, they can be even gaining weight because of the water retention. Fatigue, and that can present in many ways. For example, they have decreased exercise tolerance, or they need increased recovery time after exercise. They could be also having a history of lightheadedness or a history of syncope. So that's all the symptoms here. The signs: hypertension, tachycardia could be there, arrhythmia could be there, raised JVP, and a laterally displaced apex beat. So you have the signs and symptoms. Now, it's quite difficult to diagnose heart failure in exam question. So you have to know all the other stuff as well, like the examination and also few other signs and symptoms, so therefore you can have clues. So on examination, they could be having tachypnea, they could be having basal crepitation, or they can be having pleural effusion. They also can have heart murmurs. You can also hear the third, fourth heart sounds. Examination could also see enlarged liver, and you can get dependent edema as well. So edema around the ankle, edema around the legs. They can have also ascites. Okay, so this is the slide for finding out based on signs and symptoms. As I mentioned, that is quite difficult because it's quite non-specific. So knowing all of them will give you hints whether you're dealing with chronic heart failure. Now the management, I have two slides on this. The first slide is the general management, and the second slide is specific management. So all patients with heart failure, they need to make sure that they're having advice on fluid intake and salt intake. Ensure that they have their pneumococcal and influenza vaccine. These are important medication that we should memorize for your exam. These are drugs that should be avoided in heart failure. I'll go over a few of them, like make sure that patients should be avoiding NSAIDs and COX-2 inhibitors. Make sure they should not be taking drugs like terfenadine, which is already not licensed in UK, but they can increase the QT interval. Also lithium, tricyclic antidepressants, calcium channel blockers. You have to know the examples like verapamil, diltiazem, okay, and so on. So we should be able to understand these medication and know them by memory, which ones should be avoided in heart failure patient. Quite important for exam as well. Now, the specific management for heart failure, that's the classification of heart failure based on the left ventricular ejection fraction. If it's under 40%, then it's reduced. If it's 41 to 49, mildly preserved. Above 50% is preserved. If a patient has 1 and 2, reduced or mildly reduced, the treatment is ACE inhibitors, number 1, and beta blockers. These two medications have proven to reduce morbidity and also increase survival rate. If a patient cannot take ACE inhibitors, they are not tolerated, then they can have ARB. Secondly, we can add in MRA if needed. So on this box here, I've given you the names of this medication, examples of the name, and that we should memorize as well. So ACE inhibitor could be like ramipril, beta blocker like bisoprolol, ARB, candesartan, mRNA, spironolactone as well. So these are medications that we should know. We should know the other information about it. For example, spironolactone is a potassium sparing diuretic, so we should know about potassium guidelines and so on. Alright guys, thank you for watching.